Hello, everyone. Welcome to Inconvenient Truths. I'm your host, Jennifer Zheng. Is COVID back, or did it never leave? Or is it a new virus? Recently, numerous cities across China have seen children's hospitals overcrowded, with a widespread online circulation of news about mass infections among medical staff. There's been a surge in cases of children suffering from fever, common cold, respiratory infections, and even cases of so called white lung or reported deaths. Chinese experts said that this is a mixed infection of various respiratory pathogens, including COVID 19, influenza, and Mycoplasma pneumonia. Is that really the case? Let's take a look at some videos first. This is Beicheng Children's Hospital in Beijing. The text in the video states that the emergency department has reached 3,000 registrations, indicating that 3,000 people have come for treatment that day. The uploader of the video such advises against coming here, suggesting other hospitals instead, as they are only up to 2,000 in the queue. Here are some clips from different hospitals. See the long queues everywhere. And children coffee. This is Beijing Children's Hospital affiliated with Beijing's Capital Medical University. This is the second affiliated hospital of Jilin University in Changchun City, Jilin Province. This is a children's hospital in Tianjin City on November 19th. This clip shows a nurse overwhelmed by the workload. Thanks. The video text says that Tianjin Children's Hospital is seeing an average of 13,000 patients a day. This is Shenyang Children's Hospital in Liaoning Province. This is Beijing Children's Hospital. Many people are lining up outside, and this is inside the hospital. It's a sea of people. Okay. This is a hospital notice that reads current waiting time in the emergency room exceeds 24 hours. Another hospital notice says, dear parents, due to the high number of pediatric patients currently, the estimated queue is over 700 individuals with a wait time of about 13 hours for consultation. A parent from Tianjin City posted the registration slip showing that on November 20th, their number at Tianjin Children's Hospital was already 2,740. A post from November 21st by a doctor in Liaoning province mentions that the hospital is overwhelmed. The situation is like when the COVID registrations were first lifted. Out of 12 people in their department, 9 have a fever, 5 with temperatures over 39 degrees Celsius. And even the physically strongest director has a fever of 39.4 degrees Celsius. Pediatrics is overflowing with no beds available for hospitalization. The doctor's colleague's nephew with CT showing white lung has been hospitalized for over 20 days and is still not recovering. By the way, the white lung refers to extensive white areas in the lungs on an X-ray. This indicates widespread pathological changes in the lungs, such as infection, inflammation, edema, or other abnormalities. The doctor also mentions that their colleagues' test results showed influenza, mycoplasma, and COVID all together, which is frightening. The post mentions that half of the school-going children are infected with mycoplasma, and the children's healthcare system is almost completely paralyzed. Children over 14 years old are advised to seek treatment at adult hospitals. The doctor advises friends not to send their children to school for now, as there are hardly any places left for treatment in case of infection. She also mentioned that it's almost impossible to get an appointment at Beijing Children's Hospital now. At Friendships Hospital's pediatric emergency room, the wait time exceeds 24 hours, and other hospitals also have waiting times of 8 to 12 hours, and so on. This is a post from today, that's November 22nd. The post says children are really suffering these days. Recently, pediatric wards in hospital have been overcrowded with various viruses cause cross-infection. Kids are having fever, coughing, and even doing their homework while receiving IV drips in hospitals. The picture here is truly appalling. At first glance, it looks like a classroom, but it's actually a hospital. On November 21st, Wang Quanyi, Deputy Director at the Beijing Center for Disease Control and Prevention, told Chinese media that Mycoplasma pneumonia has been prevalent for nearly 3 months. Currently, pediatric outpatient services are still under high pressure, and Mycoplasma pneumonia is no longer the leading cause of pediatric consultations. He mentioned that Beijing has entered the high incidence season for respiratory infections with multiple pathogens circulating, and medical institutions need to be prepared for the pressure. Wang Danying, head of the Pediatric Infectious Diseases Department at Wuhan's Jingyintai Hospital, warned that many cases of mixed infections are being reported with severe symptoms, including fever and white lung, and advises patients to seek medical attention promptly. Netizens revealed that the daily patient intake at Tianjin Children's Hospital has increased tenfold compared to a few months ago, which is terrifying. Moreover, the children are suffering from repeated infections and fevers. Some netizens commented, "This virus seems much worse than COVID-19. Hospitals are overflowing. I went to the emergency room at 9 p.m. and there were over 300 people ahead of me. Even the doctors in small clinics are incredibly busy, and hospitals are running out of isomycin." Many netizens also noted that the symptoms are similar to COVID-19, generally starting with children and then parents developing fever and coughing, with CT scans showing pneumonia. Some people remarked that China seems to be cursed again, with reports of child deaths from various regions. The exact death toll is being concealed, causing widespread panic among parents of young children. Well, above is the basic situation with this wave of the epidemic. For people living outside of China, the question arises, could this be another COVID-like pandemic, and could it affect other countries? The official explanation is that this is a mixed infection of multiple respiratory pathogens, including COVID. There are two main theories circulating among the public. One theory suggests that this is a resurgence of COVID, with officials replacing the sensitive term COVID with bronchopneumonia, flu, common cold, and mycoplasma infection. Another theory suspects it might be vaccine-related side effects. Of course, theoretically, it's also possible that this is a new virus. From the treatment and medication perspective, two pieces of information have circulated among the public. One says that there are issues with the drug azithromycin, which is effective against Mycoplasma pneumonia. Some raw material manufacturers produce ineffective drugs, leading to a nationwide surge in counterfeit medications. Another piece of news, as mentioned in this post, is that human use ivermectin has been removed from platforms like JD.com and Taobao, including India-made versions, which have also been cleared out. Therefore, some suspect that this might be a deliberate act to remove the drugs from the market. This post also notes that in July 2019, the only pharmaceutical company in Zhejiang province in China that produced ivermectin was shut down. I know the topic of medications is quite sensitive, so I won't delve further into it here. Today, I mainly wanted to quickly share the news of the resurgence of the epidemic in China to raise awareness among everyone. Well, that's all for today. Please like, share, and comment on my videos. If you haven't already, subscribe to my channel or check if you are still subscribed, as YouTube keeps unsubscribing people for me. Also, you can visit my website at jenniferzengblog.com. That's jenniferzengblog.com for membership or donations to support my efforts. In these rapidly changing times, I believe independent voices like mine are very important. Thank you, and I wish you a very happy Thanksgiving. See you next time.